So we all have a health journey. Mine started in second grade when I got fit into prescription eyeglasses, and then in junior high when I upgraded to contact lenses that had a profound effect on my social life. And then in college, while I think on paper I seemed like I was a healthy, fit guy, I was pretty into fitness and things, but internally I was struggling. I was battling GI issues, skin health issues, and even some mental health issues with things like anxiety and depression. But our health journeys help shape and mold us through life. And in today's Dr. Eye Health podcast episode, we're going to be sharing my story, how I kind of experienced health issues throughout my life, and how I found the field of not only eye care, but my interest and passion in health and healthcare. This is definitely a different episode to make, and kind of, I think puts me in a vulnerable spot because I usually don't share this much personal information here on the channel, but I think sharing this information is valuable. I think it's important for us all to be sharing our health history, our health story, and I think it's good to reflect on it because it helps us better understand not only ourselves, but our loved ones, our friends, and other people around us. And ultimately, it highlights some connections between our lifestyles, things like what we eat, how we sleep, how we take care of ourselves, and how our body functions and is healthy. So today's episode's a little different, but I'm excited to share my story. So thanks for being here. Let's get into it. So most people know me as the eye doctor here on YouTube, but long before that, my journey into eye care started like way before I got into optometry school. In fact, I think it all started with just curiosities about my own confusing symptoms. Around the age of maybe 9 years old, entering into third grade, I started seeing some spots in my vision. I actually would see this kind of grayish orb flashing spot in my vision that would kind of grow or change shape. And then after maybe 20, 30 minutes, it would kind of fade, but then I would get a terrible headache. And nobody else would see this spot that I would see kind of floating around the room. And you even go to like your parent at that age and you talk about what you're seeing, and it's hard to describe, and so they're not sure what's going on either. Now, what I'm describing is an experience called a migraine with aura, and I know about that now, but it's something, again, at a young age, I didn't know what was going on. On top of this, again, still at a young age, I'd be on my walk home from school, and I'd look up in the sky, and I would see these kind of other drifting spots, or I'd close my eyes while I'm going to bed, and behind my eyelids, I would still see these kind of wafting, drifting clouds of colors and light. And nobody that I ever spoke to about this could understand or confirm that they would see the same thing that I was seeing. And so I think even at a young age, it had solidified my curiosity about the visual system, about what we're seeing, about what makes up our eyes and our eyesight, and then ultimately interest in health. Now, the time when I got really introduced into the field of eye care, the world of glasses, contacts, everything, was when I was in about second grade. And that's when I first got my first pair of glasses. Now, I don't remember my vision ever being blurry. I don't remember complaining about it. It might have been something because my mom had a high prescription and she was, already thinking, oh, I should probably get my kids checked too, because she needs strong vision correction. And so I ended up getting glasses around that age of 8, 9 years old, and wore glasses all the way up to about junior high. And that was a big moment for me because I never really loved wearing glasses. They kind of, not only were they heavy on my face, I didn't like how I looked in them, but they also kind of made me feel tired or fatigued in a way, kind of like a cloud always kind of hanging over my head. Not really like a pressure or strain feeling, but just something seemed off. I was closed in behind like a dirty windshield. And when I got into junior high, my mother, I've shared this story before in other podcasts, but my mother wanted me to pick a sport because I was very much an indoors kid. I was very much kind of a loner. I spent a lot of time reading books, playing video games, watching movies. I didn't really feel like I had many friends. And my mother encouraged me to play a sport. So I'm like, I'm going to do the manly thing. I'm turning 13. Let's play tackle football. And it's hard to play football with thick glasses on. So she brought me into the eye clinic and I got fit into my first pair of contact lenses. And so shout out to Dr. Mike Sufka, who was my optometrist when I was in junior high and inspired me and fit me in contact lenses. So that did transform my life because it not only gave me the opportunity, the freedom of not wearing glasses, and that allowed me to play sports. I started making more friends. That boosted confidence because I liked how I looked and meeting more people. I think at that time, the most important thing in my life was girls paying attention to me. And so that always kind of solidified a positive experience when I went to go see the eye doctor. And I always loved and prioritized my contact lenses. And then later, as I went through high school and everyone's like, hey, what are you going to do with college? What are you going to do for a career? I didn't really know. I actually had I remember having an existential crisis around that time. And then I just happened to coincidentally have an eye exam around that time where I always loved it. I realized that whenever they put my face behind the phoropter, the instrument where we ask, hey, does this look better 1, better 2? And we're checking for an updated prescription. I realized wow, I could really appreciate and just enjoy the crispness of vision, and just was again curious about how does this work and how powerful of an impact it can be in somebody's life to instantly bring their vision to high definition. And so I remember asking Dr. Sufka, hey, what's this job like? How do you become an eye doctor? All these different things. And so I think that's really where I got the first idea of this might be something I want to do. But still, there was this curiosity of what was going on with my eyes. Why was I seeing these floaters and even having this aura after having a migraine? In fact, I remember asking that question to Dr. Sufka when I was in high school, and he basically educated me about the existence of a migraine aura. But I still didn't fully comprehend what was going on neurologically, how they're tied together with my vision. And none of that made sense to me because I didn't have the education yet. But I think even at that time, there was this moment where I realized that if I can't understand what I'm seeing or what's going on, maybe other people can't figure this out either. And they maybe are also looking for answers just as I was. So I went to college, got my Bachelor's of Arts in Natural Science, which basically was all the prerequisites for med school and optometry school. And then went on to optometry school. And I'll share some of my personal health history, is that during this time, I was physically fit, I was active, and I think for all intents and purposes, kind of on paper, seemed like I was healthy. However, kind of just on the personal side of things, I had been struggling with a lot of GI issues, even since when I was young. And then in college, not only did I have continued GI issues, but then I started to have skin changes. In fact, I started developing what was diagnosed as eczema on my face. And I think for a lot of us, when we have symptoms of things going on with our body, we sometimes don't recognize it or don't pay too much attention to it, especially if it's something that happens frequently. We sort of normalize it. And I think that was a thing that was going on with my own health history, especially with my GI, right? If I had continuously had a history of upset stomachs or constipation or bad, flatulence or something like that, and we're humans, we all have farts and have these GI experiences once in a while. But as somebody going through college and high school who otherwise would be healthy, that having this constantly, I never connected that this was an abnormal thing, that maybe not everybody has this experience, that something could be going on or what could be causing these issues. Until in college, my own father, he mentioned, is well, Joey, I'm lactose intolerant. Maybe you are too. And so that was the first time I started thinking maybe there's some truth to that. Let me see what happens if I cut out dairy. And I instantly started feeling like a change and a shift in my whole body. And so then I started getting curious about how our health and organ systems can react and are tied to things. But ultimately, I think it was that I didn't understand yet what inflammation was. I didn't understand how sleep how stress, how the foods we eat, and other things in our environment can affect us systemically and even potentially to our eyes, which I think ultimately is one of those fascinations of why I think I've always been driven to better understand and stay curious about how lifestyle can affect us. In fact, going forward into the final years of optometry school and then into my residency, and during this time as a student, you are exposed to patients, to people that you're taking care of and seeing who have a lot of disease. In these, a lot of optometry schools, they're located in cities that maybe have underserved populations or at least have a lot of disease things going on. And so it's not just, oh, you're going to see this patient and they just need an updated prescription for glasses. A lot of the patients have many different disease happening all at once. Even more so when you're doing a residency like I did at the VA Medical Center in Minneapolis. A lot of my patients would have not just a need for glasses, but they would have diabetes, they'd have high blood pressure, cholesterol, they had a stroke, erectile dysfunction, they had depression, they're on 30 different medications, they had cataracts, macular degeneration, maybe an inflammatory autoimmune disease that was affecting them, many different things that you have to manage all at once. And then I started thinking about, chronic disease, systemic inflammation. And ultimately, I was kind of pushed by my mentors to think beyond what I was just learning in school and what I had read in the textbooks or in my notes. Instead, to start reading research and understanding not only how that research was done, but then how that shapes our clinical decision-making as doctors. And that, I think, made me grow quite a bit as a professional and echoes a lot into what we produce here on the Dr. Eye Health Show. Now, at that same time, especially in my residency, again, vast majority of these patients I was seeing were not healthy and they were struggling. But I had a few patients who would come in and they would be an older gentleman, for example, but he'd have no health issues. He would have no diseases. He was not on any medications, and they'd be in good shape and mentally clear. And enough so, you'd have to stop and be like, what is your secret? What is keeping you young and healthy? And they'd all say diet and exercise, like every single one. And so it made me kind of think, like, are these people just lucky? Are the rest of us just doomed to age and have all these diseases? Is this just part of human experience? Or is there something missing? Is there something that we as doctors, as healthcare professionals, are we truly treating a disease? Or are we just prescribing medications and treatments to like reduce symptoms and delay death, right? There's a bit of a shift in mindset. And I think that was that even more solidified for me that, hey, there's more to know than just the information that I had learned in my traditional training. And so without a doubt, that I think is one of the reasons why I've always been able to take my curiosity, dig deeper into the research, and then you see a lot of these sort of topics around things like nutrition or ways to reduce eye pressure, like naturally. These are why I try to advocate for these types of topics on the YouTube channel and here on the podcast, and why we're bringing on guests to talk with us more to get these sort of answers, but also to investigate other parts of our health. Because as an eye care specialist, I know a bit about thyroid conditions, for example, but I don't know everything. So that's why we're going to be bringing on specialists in things like thyroid conditions, endocrinology, diabetes, and other areas of the human body. And I'll just share that early on in my own kind of journey coming out of residency, that's when I first started listening to podcasts, because I got a job that was maybe about 30, 45 minutes of commute. And I had to start, filling that time. So I started listening to podcasts that were produced with guests who are doctors or researchers, and they were talking about things like diabetes, for example. And diabetes affects the eye in very critical ways. And so a lot of our education as an eye care provider is understanding diabetes, the pathophysiology, but also how it affects the eye and the visual system. And they were talking on this podcast about how just with diet and exercise alone, if they caught diabetes early enough, they could not only control blood sugar and minimize damage to the back of the eye, but they could even put diabetes type 2 into remission. And at that time, this is like 2016, I was like, I didn't learn any of this in school. What is going on? How does diet and exercise really affect internally what is happening to our circulatory system and organs like the eye? So I started making some changes. In fact, I changed my diet. I always thought I was eating a good diet. So I started changing it to include a lot more whole foods, a lot more fruits and vegetables. I started buying like kale and fresh spinach and mustard greens and all sorts of different things for the first time in my life. And I even I tried eating a true, full, purely plant-only diet, like a vegan diet without eating any sort of meat or eggs. I tried that for 3 months. And I thought, you know what, let me just try it, see what happens. I'm not necessarily advocating specifically for a vegan diet, but as I've mentioned in previous videos, and we will have in the future, there is a lot of evidence for the benefits of eating whole foods and eating a lot of plants and benefiting not only the whole body, but for the eyes. But then, so I did this kind of 3-month experiment thinking, hey, let me just change my diet and see what happens. And I noticed a lot of improvements and changes in my gut, as well as my skin and my energy levels. And I started recognizing, wow, there is something powerful here. Even if it's not for everybody, at least it worked for me. And it helped with a lot of my symptoms. And so that, again, re-solidified my interest in like, hey, let's better understand this. And so I started even researching more on areas of nutrition and how it affects the eye specifically. So again, we are going to be having some amazing guests and researchers on who specialize in areas around nutrition and ways we can reduce disease as well as prevent disease from affecting things like our eyes and visual systems. But I'll add that it doesn't just start and stop there with nutrition. There's a lot of other things, right? Sleep, around stress, about movement, sunlight exposure. There's a lot of things going on there that all affect our full bodies and our eyes. And so again, these are huge topics that I'm looking forward to not only talking about here on the podcast, but introducing on the whole YouTube channel and in future other social media posts that we'll be sharing. And so just to tie everything together, you know, thinking back to, again, when I was a kid and I had these symptoms, I had these things changing in my vision that I couldn't explain and nobody else seemed to know what the answers were. And then as I continued to go through my training and started seeing what was going on with my patients and wanting to find more answers myself and going online, I sometimes would not find the answers I'm looking for, and realizing that I can't be the only one having these questions and looking for these answers. And around that time, I also realized that a lot of my patients I was seeing in the clinic, they were consulting like Dr. Google, right? They're going online, searching for answers. And I'm like, there's really not much out there in terms of information about eye and vision care. Hence, kind of why the Dr. Eye Health YouTube channel and now our podcast and everything began. And so that all started in 2018. And huge shout out and thank you to all of the subscribers that we have now and followers, but also just extra shout out and huge thank you to all of the early supporters. If you're still watching, if you're still here, the first few thousand people that had started to subscribe and comment, the first 4 months of starting something like a YouTube channel, nobody watches. So I was just making content and posting it for, 4 or 5 months with nobody there. And there was a moment where I even was considering quitting because I felt really disheartened that, I'm putting a lot of energy and effort into sharing this and learning how to even make videos and the audio, the lighting, everything. And then people started hitting the subscribe button. They started leaving comments, and it was proof. It was validating that the information that I was sharing and putting together was valuable. It was a proof of concept. And that reignited that fire and has continued to push me to making more and more content and sharing this information and reading the comments and trying to answer as many questions as we can. But this sort of still brings back full circle of me realizing there's stuff going on with the eyesight, vision. It is a beautiful, beautiful gift that we have. And wanting to be able to not only uncover these kind of answers of why we see and understand our visual world around us the way we do, but then ultimately kind of deliver this answer, make it available for people, just as I wish as a young kid I had resources like this. And sort of just as some closing kind of thoughts for today's episode of me sharing kind of my story, my health journey, I think some important things is that be curious about your health. Be aware about your symptoms, about just how you're feeling and what you're seeing going on with your body on a day-to-day basis. And again, remain curious of why am I feeling this way? Is this normal? And seeing and just realizing that a lot of like inflammation and systemic diseases show up early on in places like the gut, the eyes, and the skin. And not only to just trust your symptoms, but be proactive about it. And don't just investigate by asking Dr. Google, searching online, or just taking my word for it. Always, it's important to consult your local healthcare professionals, whether it be your family doctor or seeing a specialist like an eye doctor, an optometrist, an ophthalmologist, or if you have even a tooth issue, again, be curious about it and make sure to schedule an appointment with a dentist, an appropriate healthcare provider in your area. Now, in addition to sharing my story here, I love hearing your stories. I love knowing and hearing about your journey, not only with your eyes and your vision, of course, but with anything else going on systemic, because I think we can learn a lot about hearing from other people, and your story might, in fact, be similar to somebody else's story, or may help somebody else who's going through something and is looking for answers, just as I was when I was a kid. And so, as always, I encourage you, if you're catching this over on YouTube, leave us a comment, please, down below. And something I'm going to read every morning, I do what I call commenting, coffee and commenting. So I go back and I read through comments and try to answer as many as I can. Or if you are catching us and listening on our podcast, please like and follow and leave us a review as well. If this is an episode that you really enjoyed, or if there's key takeaways or further questions or topics you'd like to see covered in future episodes. But just remember that our eyes and our vision is all a gift, and everything in our body, our minds, our body, and eyes are all connected. And with those final words, let me just say thank you so much for joining us here today. Keep an eye on it, and we'll see you in the next episode.
You've been listening to the Dr. Eye Health Podcast with Dr. Joseph Allen. For more resources, trusted information, and helpful tools, visit dreyehealth.com. Thanks for joining the community that's focused on healthier eyes and a healthier life. Until next time, stay informed and keep your vision sharp.